You've probably heard about it, right? Turkey has become this huge global hotspot for dental work. And the promise? It's incredible. A brand new, perfect smile with all the latest technology and all for just a fraction of what it would cost you back home. But as its popularity has just exploded, a very different kind of story has started to surface for some people. So let's pull back the curtain on those polished ads and really talk about the hidden risks.
And I mean, who wouldn't be tempted? You see these amazing before and afters all over social media. You hear the stories about the incredible savings, and it feels like a really smart, life-changing decision. That pull is powerful, and it's totally understandable why so many people are looking into it.
But here's the thing. While tons of patients have fantastic positive experiences, a growing number are finding that their dream trip turns into a long-term, living nightmare. And look, the issue isn't the country itself or the whole idea of dental tourism. It's the fact that not all clinics are created equal, and not all of them play by the same ethical rules.
So I want to be really clear. This is not about scaring you away from the idea entirely. This is about empowerment. It's about giving you the knowledge to understand the environment you might be stepping into, to learn how to spot the red flags, and to make sure you can protect yourself before any permanent decisions get made.
So what exactly goes wrong? It's rarely as simple as a fake clinic in some back alley. The problems are usually much more subtle, woven into what can look like a very professional, very high-tech operation from the outside.
When we say scams in this context, we're not talking about someone just taking your money and vanishing. We're talking about a whole pattern of systematic shortcuts, really aggressive sales tactics, and these ethically murky practices, with a real cost both to your health and your wallet doesn't actually show up until months or sometimes even years down the line.
Okay, so the first big one we see time and time again is being pushed toward really aggressive, irreversible treatments, when much simpler, more conservative options would have worked just fine. Perfectly healthy, totally salvageable teeth are often just declared a lost cause to justify a much bigger and, of course, more profitable procedure for the clinic.
You might hear these really high-pressure phrases, exactly like this one. This kind of language creates this false sense of emergency. It's designed to make you panic and feel like you have no other choice but the most extreme one on the table.
All right, pattern number 2 is the old classic bait and switch. You get drawn in by an online price that just seems too good to be true for a full package. You're excited, you book your flights, you take the time off work, you fly halfway around the world, you're all in.
But then you get in the chair and the whole story flips. Suddenly they find unexpected issues or they start pushing for premium upgrades that were never mentioned before. And that initial quote just skyrockets. And at that point, you feel completely trapped. I mean, what are you going to do? Your flight home is booked. Leaving feels like you wasted everything.
Okay, this next one is really sneaky. A clinic will promise you they're using these top-of-the-line German or Swiss brand implants and materials. Sounds great, but when you ask for proof, serial numbers, certificates, any kind of documentation from the manufacturer, it's often just nowhere to be found. They give you the runaround, or it just never appears. And this is where it gets really serious down the road. Think about it. That warranty they promised, it's pretty much worthless without proof of what was used. Dentists back home might flat out refuse to touch the work because they have no idea what they're dealing with. And if you have a complication, like an allergic reaction, it's almost impossible for doctors to figure out the cause. Now let's talk about the big stuff, like full mouth restorations. These are not simple jobs, not by a long shot. They require incredibly detailed planning by specialists, people called prosthodontists, who use advanced digital tools and surgical guides to make sure everything works perfectly for years and years. And this right here just lays it all out, plain and simple. On the left, you see how it's supposed to be done, with a specialist, with custom digital designs, with surgical guides for precision. But on the right, that's the shortcut version. No specialist, freehand work, and a total focus on just making it look good for a photo, which almost guarantees it's going to fail later. And finally, this last pattern. Honestly, it might be the most heartbreaking of all. The treatment is done, you've paid your bill, and you've flown home. But then a problem pops up. Pain, an infection, a loose crown. And suddenly, the clinic that was so friendly is just impossible to reach. This is what so many people go through. They describe being completely and totally abandoned. The messages go unread, the calls unanswered. They are left all alone to deal with serious medical complications. And the thing to remember is, these aren't just random one-off horror stories. They are predictable patterns.
And once you see them, you can protect yourself.
Okay, so we've talked about the patterns. Now let's get real about what happens when that bargain completely backfires. Because these aren't just theories. They lead to devastating consequences that turn that initial deal into the most expensive decision a person can possibly make.
The physical damage can be just devastating. We're talking about implants literally failing and falling out of people's mouths. We're talking about chronic pain that never stops, infections you just can't get rid of, permanent nerve damage, and even bone loss that can make future repairs impossible. So much of this damage is irreversible.
And then there's the money. The sticker shock to fix this kind of damage back home in the UK or the US or Canada it's just mind-blowing. You're looking at spending 3, 5, even 10 times what you thought you were saving in the first place, completely wiping out that bargain and then some.
But it goes even deeper than the pain and the money. There's this profound emotional weight. Imagine being embarrassed to smile, or feeling anxious just going out to eat with friends. People report dealing with deep anxiety and even depression. That feeling of being taken advantage of leaves a really lasting scar.
Okay, that was a lot, and it's pretty heavy stuff. So the big question is, how do you avoid all this? Well, the good news is, you absolutely can. Many of these problems are completely preventable if you know what to look for before you even think about booking a flight.
Think of this as your pre-flight safety check. First up, if anyone gives you a complex diagnosis based only on a few photos without a proper 3D X-ray, what's called a CBCT scan, that is a huge red flag. Watch out for one-size-fits-all treatment plans, or if they're vague about who your actual dentist will be. And if it feels more like a car dealership than a doctor's office with all this pressure about limited-time deals, just walk away.
But here it is. This is probably the single most powerful tool you have in your arsenal. Get an independent second opinion from a dentist in your home country. They have zero skin in the game financially. Their only job is to give you honest advice. They can tell you if a plan sounds crazy, if there are better options, and help you spot those red flags you might have missed.
At the end of the day, it really all boils down to this. Good, ethical clinics are transparent. They welcome your questions, they'll explain all the risks, they give you time and space to think. If you feel rushed, confused, or pressured at any point, that is your signal to hit the brakes. Your health is not a discount item.
So I'll just leave you with this final question to think about. When it comes to something as permanent and as vital as your own body, your own health, we really have to ask, is the cheapest price ever really the best value in the long run? It's something worth sitting with before making any big decisions.